Wait. One word?
So many words. It's hard to pick one.
One word. Oh my. One word?
Oh, I don't even know what I want to say. There's too many words to describe Mission of Mercy. Just one word?
Describing Mission of Mercy in one word.
Love.
Hope.
Compassion.
Empathy.
Beautiful.
Holy. Caring.
Extraordinary.
Love.
Love.
Love. Love.
Mission of Mercy is often described as the perfect storm, and by that I mean it is a place where high unemployment, an unresolved immigration policy, and a disastrous healthcare meltdown all comes together. So our patients are dealing with the weight of the world.
Some of them have so little that when you first hear what it's like for them to have to come here, it's heartbreaking.
They have no jobs, they have no transportation. Some of them take 2 and 3 buses to get here. Some of them ride bikes to get here.
They don't have anything, and the only thing they have is us. Mission of Mercy opens the door to them.
We are seeing so many new patients, almost 40% increase in the last 3 years. And these patients are not the chronically uninsured. These are patients who have had jobs, who have worked all their lives, had that company healthcare policy, and the rug has just been pulled out from under them, and they find themselves unemployed and uninsured.
I had insurance since I started working. So it was my first time being without insurance.
When I lost my job and when my husband lost his job, I felt depressed. I was worried all the time. I was scared. I didn't know how we were going to put food on the table. And medical was cut out. We weren't able to go back to the doctors. And at that point, we had found out that my husband was diabetic. I didn't know what to do. I was very, very scared.
One of the things that's really unique about Mission of Mercy is that not just being a free clinic, because there's other free clinics here in the Valley, but that we really feel it's important to do the whole service for the patient.
We do not take any state or federal funding. That means that the patients that come to our clinic don't have to prove their poverty. They don't have to plead their need. We take all who come.
The thing I enjoy most about this clinic is I'm able to do my work as a doctor, and it doesn't cost the patients any money.
I consider myself to be a humanitarian, and I think that the whole clinic here is a humanitarian approach to healthcare and to the community.
The van is so very special because not only are there examination rooms on the van, but there is a pharmacy on the van that travels around to the 5 locations in the valley, providing medicine for these people who need it so desperately.
They get their diabetic or blood pressure screening, they get their medication, they get labs done, and it's just really beautiful to see how they get help by the doctors, the nurses, and the other people that are volunteering.
For me, healthcare is a basic right, not a privilege, and everyone needs to be entitled to get the same quality care. Mission of Mercy meets that beautifully.
Our mission is healing through love and the restoration of dignity.
The doctors and nurses are very professional, and the doctors show them love and that they care about them, and that restores their dignity.
The power that Mission of Mercy gives us is just to reach out and restore their dignity, not to let them feel like less, to make them realize how much they are loved and cared for by the people here.
And by the end of their visit, you see their entire body language has changed. Where there was fear, there's now a smile. Where there was tension, they're now relaxed. And they know that life is going to be just a little bit better for them.
I think educating the patient is probably the most important thing you do with any patient you see. We try to get them to be able to empower themselves to take the first steps towards regaining their health.
You know, you just take a lot of things for granted. You think everybody knows how to do all these things to take care of themselves, and you find out they really don't.
We empower patients by giving them the tools to manage their health conditions. We provide education, we provide the medicine, and we provide the support system that will allow them to manage all the aspects of their health care.
There are patients who have come in who have no resources whatsoever, and I'm able to guide them in terms of how they can get other resources than just medical care. You know, they come back and they're grateful.
The goal of Community Connections is to connect our patients with resources in the community, and we do that by collaborating with partners in the community and bringing resources to the clinic that can provide opportunities for health literacy, patient education, and support services. In partnership with Esperanza, we're teaching an evidence-based curriculum of classes in an after-school program here at the clinic. And so the students arrive after class and they participate in the physical activities. So it might be basketball, it might be dodgeball. And then after that, we go into the kitchen and we might prepare a healthy snack just to teach them everything about healthy eating habits and how they can prepare foods more healthy than maybe they might be doing right now. And so the kids learn all about healthy eating habits. And this is a perfect example of how we're bringing community partners together to help our patients.
There's no other place I've ever worked where you get more appreciation from the patients. You get more hugs, you get more thanks, you get more gratitude, and you leave the day as tired as we are at the end of the day. You know that you've provided something that you don't get in other healthcare settings.
We walk away out of the clinic with those warm feelings, those feelings that we have made a difference, but also that we have been enriched by the life of each one of our patients.
Being able to give somebody their health back is the most powerful, rewarding experience you can have, I think, in life.
My husband and I have been coming to Mission of Mercy for 5 months, and it's been a godsend. And I know now that my husband's being taken care of, and I know that when he comes here, he can see an actual physician and be taken care of, and that's a huge relief to me.
I have been changed through this because every person is a gift from God, and as such, we too have to be a gift for others.